discharged in the last 24 hours. We are thrilled for the recovery of those 203 Coloradans. Unfortunately, the death count continues to go up. We're at 391 fatalities today. As our nation continues to face a record number of deaths every day, we're doing our best to keep Coloradans safe. Over 43,000 tests of Coloradans. And today we're going to talk about a few things. There's going to be some additional steps that we are implementing and enforcing to protect our most vulnerable population of the state, particularly folks who live in nursing homes, senior care facilities, elder care facilities, as well as all of us. These will be additional steps that will help keep us safe in the difficult days ahead. We know that facilities that serve seniors are particularly vulnerable for infection. In fact, when we first had our first case or two, you might recall Washington State was infected earlier than us, and there was a nursing home there where 17 people passed away, and that was, at that point in time, was a big percentage of all the fatalities in Washington. In fact, it was so early, that was probably a big percentage of all the fatalities in the country. It was very early on before it hit New York in a major way. I called Governor Jay Inslee, who's a friend of mine. We had served in Congress together. He's the governor of Washington. And I said, what do you know now that you wish you knew 2 weeks ago? Because we were just at that first two cases. And he said, what I wish I knew, because they didn't know this at the time, is protect those nursing homes and senior care facilities. And we didn't waste any time. This was well before anything like a stay-at-home or anything like we did that. We took our very first actions where we put very strong limitations in place restricting visitors to our senior care facilities, which is tough, right? Because kids and grandkids want to visit grandma and grandpa. But we put those restrictions in place, and then we required facilities screen staff and visitors. And that even means the contractors coming in, the person who's coming in to fix the air conditioning or heating. Of course, the daily nursing staff, attendant staff, screening, looking for symptoms before they come into the facility. And a host of other standards that we put in place around social distancing for residents, isolation precautions. That means making sure that isolated folks are limited to where they are, and communications with residents. And I think the toll would be far worse had that not been put in place, but that's not an excuse that we shouldn't be doing more. And today we're going to talk about some of the additional steps we're taking. And it is working in some places. We find that compliance is good in some places, spotty in others. I mean, I heard from a 86-year-old friend of mine in Boulder County in an assisted living facility, and she was telling me how they're always in masks. They're only leave their room if the hallway's clear. The food services are being done in a safe way. I've heard from others in other facilities that they're still worried about people not wearing masks at times or people congregating. So we're focused on enforcement and compliance. We've got, a big part of the people being hospitalized are seniors. We know this virus is deadly for people of all ages, and, to be clear, most people will recover. Even most seniors will recover. But while it has been, there was a 21-year-old baseball player at Mesa that was whose life was taken tragically by this virus a week or so ago. But the fatality rate and the hospitalization rate are much higher for people in their 70s and 80s who are otherwise perfectly healthy. I mean, yes, people with pre-existing conditions, but if you could be a healthy, active 78-year-old, and we've heard so many cases where it just lays you up in a hospital, and all of a sudden you either make it or you don't. Just a very quick downturn for people. So we really need to step up our steps here for our long-term care facilities. And today we're updating the public health order to require long-term care facilities to develop a detailed isolation plan and submit it to the Colorado Department of Health by May 1st. What that means is, while many of them have these plans in place, we want to make sure every nursing home, senior care facility has in place the plan where if somebody is showing symptoms, COVID-19, if they have a roommate, what's the process for making sure they're in a different place, right? So they're not in with their roommate. What's the process for isolating staff so they're not then picking it up? Maybe the staff is younger, won't be symptomatic. They could be spreading it to others. The staff may have mild symptoms. So they have to have that in place. With so many vulnerable individuals and also frontline caretakers that are in close contact, we really need even better planning better protections to stop the spread of the virus in these facilities, particularly as the stay-at-home and these severe restrictions in place roll off. We need to really up our game in practice in all of the senior care facilities across our state, and that's our focus. I'm also announcing today that we're deploying the Colorado National Guard to conduct testing at 3 of the largest nursing homes in the state to help prevent outbreaks. And we're deploying additional testing resources and personnel to other facilities as needed and as the capacity increases. But the larger the facility, the bigger the risk. The bigger the risk for 2 reasons. The bigger the risk with all those workers, all those residents, that somebody might bring in the virus. And then, of course, the more catastrophic the result, the larger the facility. So we really are focused on handling the biggest ones first and then working our way over. And we're also adding isolation beds at the state level. In early May, we're expecting 200 beds in supplemental facilities that are available for isolation of seniors if their own facilities can't provide those beds with isolation. So meaning we can get an outbreak early. If their isolation plan doesn't have rooms to help separate people who are symptomatic from non-symptomatic, we can pick up some of that until they recover at our facility, or if they need hospitalization, they would obviously go to a hospital. But for those who don't need hospitalization, it's important that they are identified and isolated. Those very first beds are at St. Anthony's North in Westminster. We're also going to be a lot more focused on compliance and enforcement because the safety measures in place for our senior care facilities are strong, but we really need to up the bar on enforcement on safety. We know that you all want your parents, your grandparents to have the very best protection if they live in Colorado, and we want to do our best as a state to provide that. And if you live in one of these facilities and you're watching this, know that we really want to up the bar because we want to do everything we can to keep you safe so that when this is all over, you can once again embrace your kids, your grandkids, your friends, and others, as well as hang out with your fellow residents of your facility in larger gatherings when finally this horrific period of our history has passed us. The protocols that we're putting in place are really about providing additional education and training to staff to keep the facilities safe. They need to be followed, and I want to show you a video about the proper screening of someone entering a facility. It's really very similar to the process we use at our own state emergency operations center, where I've done several press briefings. We have a nearly identical procedure, and in fact, it works. Not every time, but it did catch a member of the emergency operations center early. They found a manifested a temperature, isolated them, and it didn't break out there in a broad way. We want to catch it as early as possible at senior care facilities. This is a big part of it. I'm going to roll the video, and you'll get to see exactly what we mean. Roll the video. So there's essentially what they're doing is it includes a temperature check, a bracelet for approval, and then they go on with a secondary screening with a few health questions just if the person has had those symptoms. This is demonstrated to be effective. We do it ourselves. Most senior care facilities should be doing something almost like this already, and they're all going to do it going forward, and we're going to make sure we do our best to educate people about the importance of that. I'm also issuing a new executive order around masks. While many people are wearing masks at the senior care facilities, at grocery stores, and other critical jobs, there still are some that are not. And this new executive order will require that the workers in critical businesses and critical functions, like grocery store workers, for example, and staff at these senior care facilities, who are going to work each day to protect our seniors or our food supply or our roads, where they interact with others in close proximity, they need to wear a mask. Or they can either be a medical mask or a non-medical cloth mask like this. It can even be one they make at home. But they need to have a facial covering that covers their nose and mouth at all times while they're working. Of course, there's an exception if that interferes with their breathing or they can't wear a mask for some reason. But essentially, everybody who can should be wearing a cloth mask, and you should see that. Hopefully, you've been seeing that already at your grocery stores. but you are going to be seeing that guarantee going forward because we are requiring that those critical workers wear masks. Most employers and workers are already doing this, and we salute them for their proactive steps. But we don't want to prolong the pain for everybody else just because some aren't. And the more people wear masks at these critical workplaces and when going about their necessary errands, the more lives will be saved, and it could be your life, and the sooner we can get the economy growing again. So please, if you work in those occupations, you will be wearing masks. If you're an individual, please wear your mask when you're out and about. When you go to the grocery store as a customer, we wear ours when we walk our dog around the neighborhood. Wherever you think you might be in proximity for other people, make sure to wear a mask. It's effective in a number of ways. It will save lives. That life could be a loved one. It could be yours. And you're going to see increased use of masks. As we talked about from several weeks ago, a culture of wearing masks allows us to have a greater degree of economic activity, of growth, of being able to earn a living sooner rather than later. The more of us are doing it. And it's incredibly important in particular in our senior care facilities and for our most vulnerable. Their lives are quite literally on the line. And as of today, it is the law of Colorado that an additional common sense measure of wearing masks will help protect us from the spread, prevent deaths, and get us sooner to a greater degree of economic normalcy and being able to live in a sustainable way while we continue the needed social distancing in the coming weeks and months. I'm glad to have some good news. We have made the first rounds of grants from the COVID-19 Relief Fund. First of all, I want to thank all of the donors to helpcoloradonow.org. If you would like to donate, there was somebody who wrote me online that said, you know what, I'm lucky enough to still have my job. I don't need the $1,200 that the government sent me. How can I help? And I said, thank you, helpcoloradonow.org. It'll go to those who need it the most right now. Well, we've raised over $11 million. We received $21 million in grant applications, and there's $5 million, $4.8 million going right out the door now, right out immediately to help people. About half of what's currently in the fund. That money comes in, it will go out. It's no overhead. It's Mile High United Way. It's a number of others that are partnering together to really make a big difference. And it's funding 206 organizations that are direct assistance for people in 62 out of 64 counties here in Colorado. So we still need applicants from Rio Blanco and Custer to step up and apply because we want to get that help out in all 64 counties. So let's get those applications in. Helpcoloradonow.org. Please, if you're able to donate, if you're able to volunteer, if you work with an organization that's ready to help those most in need. And what does that money go towards? It goes to families who are impacted by school or child care closures, meaning frontline workers, healthcare workers that we need now more than ever, but they need a place for their kids if they're going to be able to work. Healthcare, hospitality, service economy workers, workers displaced by business closures, workers who didn't have access to paid sick leave, older Coloradans whose income is jeopardized, homeless, people with disabilities, immigrant and refugee communities, tribal governments, and victims of domestic violence or child abuse. The fiscal sponsor, the United Way, is processing these disbursements right away. They're doing a great job. I want to thank them. Money's starting to go out the door today. We don't sit on anything, we get it out the door, and we know how important it is to get that out right away. The fund now is at $12.2 million. There's a generous gift that we wanted to thank today. Pinnacle Assurance donated $1 million, so I want to thank Pinnacle for the help. It really means the world. And Colorado Health Foundation stepped up to help with a $2 million match challenge, and you can help match that at helpcoloradonow.org to make sure that that can be fully tapped. Thank you for stepping up and doing your part, everybody who's signed up to volunteer, to donate, and obviously if you're in need of assistance, I hope you're getting that through some of these partner organizations. I also want to announce some more good news. I'm glad to have some good news in these tough times. Gig workers, independent contractors who've lost revenue due to COVID-19 can now apply for unemployment insurance in Colorado starting Monday. You'll remember that that already applied to traditional employees, W-2 employees. That's most of us, but then there's so many people that work several jobs or independent contractors. We call it gig economy, shared economy. They're now eligible too. We've been waiting on the federal guidance on how to administer that. We have that. The Colorado Department of Labor and Employment has gotten that going. In addition, the $600 extra per week in federal unemployment insurance from the CARES Act should start to show up in checks this week. In the coming weeks. So we're very excited about that as well. I know a lot of families are counting on it, and it really is crucial to making ends meet. Go to coloradoui.gov for more information on these two programs that we've gotten going as quickly as possible. I also want to praise the Office of Economic Development and International Trade for their really quick work in getting Colorado business access to the Paycheck Protection Program. Colorado received the 12th most grants out of all 50 states, and that's because of their quick work of not just the state, but the banks and, of course, the employers. And we are all advocating that we increase that Paycheck Protection Program so more companies can keep people on payroll while their revenues are slowed. I sent out a letter to our federal delegation. We had a call with them this morning, Republicans and Democrats, talking about the importance of this program. And we also sent a letter with county and local officials outlining the need for funding for local and county governments during this crisis. And we really are focused on advocating for Congress in a bipartisan way. Speaker Pelosi, Mitch McConnell, Donald Trump, everybody there working together to really provide the necessary need to get our country through this very difficult period. On Monday, we released racial data regarding causes of COVID cases and deaths across different demographics. And the data showed that some communities of color are more likely to suffer from COVID, higher fatality rate. And as I said Monday, it's likely a proxy for other social inequities. And you know, that includes that people are statistically less likely to have access to health care and sick leave, depending on their race. And today, we really want to show our commitment to addressing those disparities. I'm establishing the Coronavirus Health Equity Response Team to address these inequities and ensure that everyone, regardless of their race or ethnicity, has access to the resources they need to keep themselves healthy and safe. Their task force is going to focus on ensuring equity as a factor in decision-making, increase access, making sure there's equitable access to testing and care, and ensure that there's even more transparency about ethnic, racial, geographic data. It's really important that we address all of the inequities in this COVID crisis, because we're all Coloradans, we're all Americans, we're all humans. And when it strikes one of us, it increases the risk for all of us, regardless of that person's income or race or where they live. The team will be headed up by Webb Brown, the director of the Office of Health Equity at the Colorado Department of Public Health and Environment. And finally, with the weekend coming up, I want to reiterate our guidelines for outdoor recreation. Usually I like sunshine and good weather, but I have to say I was cheering the snow yesterday and the cold weather, because I knew it was helping people resist temptation and stay indoors. It looks like it is going to be a little bit nicer this weekend, and it's important that if you're going outside, first of all, again, you minimize that, you go out when you need to, but don't drive outside of your local area. Stay in your local community parks in your neighborhood, and always stay 6, 10, 12 feet away from others. Wear a mask if you're in a park with other people. That doesn't mean you need to wear a mask when you're doing your own yard work or something like that. But if you're going to a park and there are other people, even if they're distant, it's safer. And use your local parks. This is not a vacation. It's a pandemic. We need to treat it responsibly, accordingly. Not out of anxiety or fear, but out of caution, right? We're all dealing with these different kinds of emotions. It's not about anxiety or fear. It's just about carefulness and caution, and really doing that in a rational way, where you're saying, I don't want to put myself, my loved ones at risk here. We don't want Denver residents driving to the mountains. We don't want mountain residents driving to Mesa County to use bike trails. People really need to stay in their local area. And if you're out walking, and again, I hope that you're doing that, the minimum that you need to, keep a distance. Don't congregate on the trailhead or the trails. Go some distance, 5, 10, 12 feet off the trail, let others pass. Look, Colorado's amazing mountains and trails and roaring rivers and snowpacks will be there when coronavirus is long past us. They're going to be here long after you and I are gone. They're going to be here for thousands and tens of thousands of years. So let's just show some patience here in the coming weeks so we can stop the spread of the virus and bring back a greater degree of normalcy. And while we're on that subject, I also want to talk briefly about the public health perspective for rural areas as well as the economic perspective. Right now, this is hitting our urban areas and mountain communities very hard, but a new report from the Council of State Governments and new data has really shown how the crisis is really impacting many of the rural communities across the country, whether that's in South Dakota or whether that's in Colorado. We are likely to continue to see large numbers of uninsured individuals and families, less access to healthcare and hospitals. It's easier to overwhelm a system when there's not a large healthcare system in place in many of our rural areas. There's often greater at-risk population. Many of our rural areas have an older population. There might be others with underlying health conditions and poor connectivity. There's lesser ability to do telehealth and harder to do transportation in many of those areas too. So we're working with counties in every corner of our state to really mitigate the impact of the virus, because no matter where you live, urban, suburban, rural, mountain, we all need to take this seriously. We all need to stay at home except when absolutely necessary to help save lives. And the better that we do this, the more effective that you are at staying home and preventing the spread, the sooner we can go back to more and more normalcy as we enter the second phase or the sustainable social distancing period of this crisis. On Monday, we are going to talk more about what to expect as the economy opens. As you know, there's 3 phases that we laid out. Similar to the 3 phases that the CDC and the president laid out. Ours have slightly different titles, but it's the same general concept. The urgent phase, we're at the tail end of this now. That's slow the spread of the virus. That's giving us the time we need. The beds are being built. The PPEs being acquired, the gloves, the masks, that's all happening. We're working hard to expand our capacity. And then, of course, with the stabilization, how do we prevent it from spiking again? The virus will not be eliminated from Colorado. That would take months and months and months and months and months of a shutdown. I think I saw a projection that if New York wanted to eliminate it, they'd have to stay closed through September. We know that's not realistic. That's not what Coloradans could do or would want to do. So as we move towards opening things, we have to be able to sustain the social distancing. And that means doing things in a different way, because we want to make sure we don't exceed the hospital bed capacity. There are more deaths ahead of us than there are behind us with regard to COVID-19 in Colorado, but we want to make sure that everybody who contracts it has that fighting chance that our healthcare system can provide. In most cases, it's oxygen treatment. Well, first of all, in most cases, you don't need hospitalization. 9 in 10, we don't need hospitalization. Now, over 70, over 80, more need it. Oxygen for many of them. And then, of course, for those most severe cases, there's additional care like ventilators that might be needed to give them a fighting chance. So that modeling will help show us more about the key need for social distancing that will be in place for the months ahead. A sustainable way. People need to earn a living. People need to be able to do enough things and enjoy life in enough ways that it's sustainable for a month or two. We know that everybody has cabin fever right now, and we need to stick with it and really stay at home these next 10 days here. But we know that what comes next is not going to be like life was in January or February, and we need to be very careful to not give that virus a foothold for an exponential trajectory in our state. And that's going to be based on your decisions, not mine. We'll give you the guidance. We're going to tell you to be a part, but we hope that, and I trust that the people of Colorado will behave responsibly and prevent us from having a situation where we're forced to choose between losing tens of thousands of lives or going back into more severe restrictions in the future. So I know that the people of Colorado are up for that. And then finally, the recovery phase. We all are excited. Bring it on. The sooner the better. I after all this is done, I never want to hear the term social distancing for the rest of my life. The recovery phase is life to normal, and that will happen. There's a light at the end of the tunnel. Most of us are going to be just fine and get through this. Even most people that can track coronavirus, most of you are going to be just fine. But because the fatality rate is so high, that's why we have to take these precautions. But we'll get through this. All restrictions will go away. We'll cheer on the Rockies. We'll cheer on the Broncos. We'll go to massive pews at churches and synagogues across our state. But that won't happen until there is a cure or a vaccine, or if there's not either of those, until there's more of a herd immunity that builds over time. So I think that will happen. I'm optimistic. Right now, if you had to ask me which one is most likely, I'd say probably effective therapy, meaning a cure is probably more likely before a vaccine or before herd immunity. I certainly hope I'm right. I know you all do too, because vaccines take longer to test, but that's still months away. There are some therapies that show marginal improvements now, but we're talking about something that would render this treatable. It's not treatable now, right? I mean, think about it. Your kid gets strep throat. Mine did last year. They get amoxicillin. They're better in 48 hours. 150, 200 years ago, you got strep throat. That would often lead to scarlet fever, and it was one of the leading causes of deaths for kids, right? So game changer. Nobody worries about strep throat because we got it. We got the cure. No, not a vaccine. We got a cure. There's not a cure for coronavirus. There's therapies that have some improvement for people. We're experimenting with them. We encourage them. There's several clinical tests in Colorado. There's dozens and dozens across the world. But we need that game changer to be able to get back to that recovery phase. And this will, I think, inspire a whole new generations of scientists, both on the public health side as well as the molecular biology and biology side, because it shows the importance to humanity of the work that our scientists are doing. And I want to thank our scientists toiling away in the labs, working on vaccines, working on cures, CU, CSU, the whole world over. The whole world over. And wherever that cure comes from, it's going to be a game changer for humanity, for America, for Colorado. As we work to, this is the work from yesterday, we'll go to the next slide, but as you know, these are the key factors that we identified about kind of what is going into the move from urgent to stabilization. It's the work to suppress the virus, meaning we go from in a scenario where it's actually decreasing, which is where we hope it's at now and where we hope the data shows that it's at now, to a time where it probably starts increasing again, folks, or it stays the same, increases slightly. It'll have to be managed at that level. Increased ability, which we've increased 10 times the ability to do testing since this started. We're trying to increase the ability over time to do containment. What does that mean, containment? First of all, it's individual responsibility. You're sick, you stay home and avoid others. That nothing can substitute that. But we also have epidemiologists for the state, and we're going to have more that will try to do what they call contact tracing. Who did you come in contact with? Can we put them under quarantine because we know that they might be contagious before they're symptomatic, and that can have an amplifier effect if that comes in place in May and June and July. Again, we have some capacity now. There'll be more in the future. Very, very important. Additional protections for those who are at most risk for COVID-19. That's the step we're taking today. We had some from the very start, but we're adding that today. And that includes our most vulnerable, but it also includes those who encounter a lot of others, like grocery store workers and first responders. So those masks are a very important part of that. The ability of the healthcare system to handle increased demand. The hospitals have done a great job adding capacity. Many have added 20%, 10%, 30%. And then, of course, we have the state facilities that will be completed here in the next few days, at least the first, I think, 400 or 500 beds. Social distancing policies that are sustainable, that again, we all know this isn't going to go back to the way it was in January and February, but we know that we want to be able to sustain this for a period of months. What does that mean? It means you're able to get a haircut. It means you're able to have a dental cleaning. We know that people can't go for very long without those. I need a haircut now, and I know that this first phase is almost over because, like many Coloradans, I'm saying here, this goes on much longer. People are going to be tempted just to see if a stylist can come to their home and do their hair. That's if they can't do their hair themselves, and you don't want to see me cut my own hair. It's going to be, or my partner do it, or God forbid my kids cut my own hair. That would be even worse. But we all know that needs to be part of that new sustainable normal. We're learning every day from other states and countries. We've seen Denmark open up their schools. We've seen Austria open up their shops. We are watching in real time what other states are doing. I am in regular contact with our neighboring states as well. And, many of the reporters here in Colorado, many of you at home, have looked up and read about the Spanish flu pandemic about a century ago. How interesting. It's almost exactly a century until another pandemic that threatens us here in Colorado and across the world. Just like today, at that time, the governor of Colorado was forced to close businesses to stop the spread of Spanish flu. And after the first wave hit Denver in October of 1918, a lot of people thought that the threat was over and everything went back to more or less normal. But it was too soon. They didn't keep up the social distancing. And the second wave was deadlier than the first. And ultimately, about 1 in 100 Coloradans died of the Spanish flu. 1 out of 100 died. And today, thankfully, while the modeling is far from perfect, and the only thing you can be guaranteed when you look at the modeling on Monday, I'm sure even the people that are presenting prepared, the only thing you can guarantee is the modeling's wrong. But the modeling still gives you some scope of what we're facing with regard to this and the need to be able to sustain the social distancing for a month and more, right? My staff gets mad when I put it my healthcare folks. I say we're talking about a month here and what we're doing in May, and they say what about June and what about July? And I said we're going to be informed by real data in May because what the models we don't know. It's nice to see what they say we're going to be at May 15th, but we're going to have to see what we're actually at May 15th. But we're looking at it over that time frame. Get back to a sustainable way of life. People can earn a livelihood. Our economy can grow. People will be free to be able to exercise their individual responsibility to stay safe and additional protections for our most vulnerable. And if we don't do that, like they failed to do in 1918 because out of ignorance, they didn't know they needed to, we are doomed to not only repeat the mistakes of the past, but it could be even worse. And the crisis will be prolonged. The economic crisis, the humanitarian crisis, the health crisis, all aspects of that crisis. So thank you for staying at home. Thank you for doing your part. Thank you for wearing a mask when you absolutely need to go out. You're now going to see have more security. Those others are going to be wearing masks where you're doing business. And we're going to get through this. We're going to get through this. This really shows, just as it is a difficult time, it also shows what's best in us. And what's best, it's a real test of character for Coloradans, a test of our individual responsibility to stay at home and avoid spreading the flu, picking up neighbors for your elderly neighbors so they don't have to go out. HelpColoradoNow.org if you are getting a government check and don't need it because you still have your job. We're all in this together. We're all in this together as Coloradans, we're all in this together as Americans, and we're all in this together as humans, as we watch and learn from the actions and reactions that are occurring across the entire world. With that, we'll open it for questions.
Governor, is April 26th going to happen? Are we going to drop the stay-at-home?
And you've just been listening to Governor Jared Polis give an update on the coronavirus, him telling us to stay the course, also not wavering right now on that stay-at-home order, which continues to be April 26th as of now, telling critical care workers or critical workers to keep their masks on, as well as telling people to stay inside, especially on this beautiful weekend we're about to have. We'll have more on the governor's remarks coming up at 5 o'clock.
Appropriate. It's more appropriate than when for a while the president was saying somehow he was going to make all those decisions. I think it's very appropriate that governors make them. States are in different conditions. States have different levels of the virus. They have different population centers. Even within our state, you might recall that before there was a statewide stay-at-home order, there was an Eagle County one, and there was even a tri-county in Denver one. So there were areas of our state that had a greater presence of coronavirus that took additional measures upon the state. I expect that to continue in our state and nationally, meaning there could be, I dare say, I'm usually an optimist, but I think it's more likely that there will be hotspots in our state and nationally, and those need more of a targeted reaction, meaning when there's a hotspot, we need company-wide. It could be a site, a plant, a company, like we're seeing JBS, right? It could be community-wide, it could even be county-wide, but we need to get on that in a targeted way rather than a statewide way for areas that don't have outbreaks. It's similar nationally. So we're gonna have different reactions in different states. The guidance from the CDC and the administration The phase is very similar to the way we presented a day or two before, and we look forward to continuing to work with our private sector partners, the federal government, as well as our neighboring states and other states as we enter a sustainable social distancing phase for this crisis. In the room? Yes.
To what extent your equity relief fund will work similar to recent California program to support people with
Governor Polis, Jennifer Kowalski with Denver 7. We found many vape and smoke shops across the state staying open despite the public health order. What is your response to that and your message to those businesses?
Well, we want to get every legal business open as soon as we can. And the more folks are illegally congregating people and spreading the virus, the harder the more pain that inflicts on the rest of Colorado and the rest of the economy, which is playing by the rules and staying home. So we all want to get every legal business open as fast as possible, as safe as possible. But the more folks are violating that, the more it causes delays for the rest of us. This is not a contest to see what you can get away with. It's a contest to see how best you can prevent interactions from others and have a greater distance from others. Because the more that we do that, the less the virus will spread and the greater the sense of normalcy we'll have sooner rather than later.
Governor, this is a state that well before the coronavirus had what you call news deserts all over the place. With the economy having tanked to this extent, many in this already struggling news business have seen years worth of decline in a matter of weeks. In this particular moment, when accurate and up-to-date information is so important, I'm curious what impact you believe that the trend of losing the news will have on the state, and also whether you believe any form of government intervention, including providing funding of any kind, is appropriate to address this trend.
So I want to first of all thank the Denver Post for opening up their coronavirus articles to those without subscriptions. It's so important, especially in these times, that people are able to turn to trusted, objective news sources for the information that we need to protect ourselves and our families, and I want to thank them for that. So we're in an interesting situation with regard to news, and that's, TV news and print and everything. There's a lot more consumption of it. You have more viewers, I assume you do, Alex. I haven't seen your statistics, but everybody does. But less revenue, because the advertisers are going away. So more viewers, less revenue. So what does that mean? It's a challenge of how do you convert some more of those eyeballs into a meaningful revenue stream, knowing that the advertising side of things is going to be tough. Hopefully it'll come back as somewhat as many of these areas are reopened, but it's going to be tough. So you got the eyeballs, you need the revenue. It's a challenge we face. Having more eyeballs is a good thing, first of all. I mean, it's good for the business model of anybody, no matter what your business model. If you're getting less revenue per eyeball, no matter whatever fixed level of revenue you're getting per eyeball, you still want more people viewing, because that means more revenue. So more people viewing is a good thing. It's harder to convert that into revenue. Government intervention is a tough one, Alex. I mean, we have a free and independent press. That is hard to reconcile with government assistance. The minute that you have a Governor Polis or President Trump is paying you or propping you up, that causes, if not a compromising of professional independence, and it might not, an appearance of impropriety. And look, other countries have struck some degree of balance. I mean, there is something called BBC, which is a great news source, Al Jazeera, partially government funded. We even have PBS here in this country. But in general, I would worry about having government support with the strings that it came with, that would prop up and potentially influence an independent press. That doesn't mean that there's other ways that the government can help. There's certainly ways that you can look at specific tax laws or rules that relate to the independent press that could benefit and maintain the viability of the independent press. But I think it's important that we avoid any compromising of the independence of the institution of the press in America and in Colorado. Telephone? Let me give you an example, Alex. It's stupid requirements. I would have said it was stupid a year ago, and it's still stupid, and someday it has to go away. You know, you change your name and you got to take out an ad, you know, in the local paper, in the public announcement. And in the long run, you know I'm a free market guy. I think that's silly because you can do it online. Let me just say that if they tried to do that now, I'd veto it because we got to keep that little revenue source there for our press. Talk to me about it in 3 or 4 years and I'll get rid of that requirement and you guys will oppose it. But right now we need the money from those name changes and everything else and those public notices, and you know, that's a key source for those little papers. So keep that going and, you know, we'll fight that fight some other day. Phone?
Charles Ashby from the Grand Junction Gate Sentinel. So there seems to be some confusion that I'm hearing out here about what's happening with the CARE Act money that the state is getting. You may be aware that Representative Tipton sent you a letter asking about that. CCI sent out an email this morning. They seem to think that part of the money that you guys got, you're supposed to share with smaller communities under 500,000, but the act seems to be clear about over 500,000. So can you define or tell us where that money is going? I think it's 1.7 billion.
Yeah, we were surprised by the letter, and I think I saw Rose's tweet, and I've talked to Congressman Tipton. We didn't say anything about that. In fact, when I talked to Congressman Tipton, what I said is, look, Scott, you used to be in the state legislature. You know how this works, and now you're in a national legislature. The legislature has the power of the purse. So the JBC, the members of the legislature, are going to work through this. And that means they're going to have their competing interests that they're going to need to balance, right? They're going to be hearing from their mayors and their counties saying, we need help. They're also going to be hearing from their school districts and others that get funded by the state saying, wait a minute, if you're sending money there, it means there's less money for schools. So that's the work that we do in representative government. We, of course, look forward to working with the JBC and with the legislature. But right now, we're also focused on how we're on the same page with our municipalities, our counties. We did a joint letter with the Colorado Municipal League, with Colorado counties, talking about what should be in that next phase, that phase 4 of federal assistance, which Congress is working on. The bipartisan negotiations continue between the White House, Senate Republicans and Democrats. Yesterday, I joined a letter from Senator Gardner and Senator Bennett that asked for additional help for state and local governments, $500 billion that would play a major role in helping to plug, not all, there'll still be belt tightening, city, county, state, belt tightening, just as there is in the private sector, public sector doing its part too. But at least avoid some of those severe consequences at the local level, which we can do when Congress steps up, and I'm confident they will. There's a lot of bipartisan goodwill around getting to yes. In the room? Phone?
Yes, go back early with Denver 7. This is regarding JPS. Do you have any updates on how many employees have tested positive for COVID-19? And I understand there was a call with CDC today. Is there anything you can speak to about that, particularly if there are any plans to extend or shorten their closure?
I couldn't hear what the first part of the question was. You were asking about what again?
JPS?
JBS? Yeah, they have. So they had closed, I don't know what day we're in now, but it was 14 days. And I think we're probably, what, 6 days in, 5 days in, 7 days in. So as far as I know, it's still on that 14-day plan. They did some additional testing there. We want to see, obviously, more testing. And then when it opens, significant additional safety measures. Many of those have been implemented at Cargill. And that includes everything from masks for every employee to the set physical barriers and separations. A lot of that this time is being used at JBS. They're working very closely with Weld County Health so that they can be brought online as soon as possible. It's important for our ranchers, for the national food supply, but also in a way that's safe for workers, that workers have the confidence that it's safe and it can prevent an additional outbreak that could cost lives. And we mourn the loss of at least 3 workers at JBS in Greeley who've lost their lives to this, and 1 worker at Cargill.
Governor, it seems like you're trying to prepare people for the eventuality that there's going to be a spike in cases once the restrictions start to come back. Can you talk about a little bit, why not wait an extra month and hold on to the stay-at-home order like some other states are, or what you're going to tell people if they're angry with you a week or two afterwards when cases start rising, hospitals start getting overwhelmed potentially, and more people start dying?
Yeah, well, we have to manage in a way where our hospitals and the additional capacity that we brought online don't get overwhelmed. We want to avoid another spike, as you put it, but it has to be managed at a level that doesn't exceed our ability within our healthcare system to be able to support and give everybody a fighting chance who contracts it. What the data shows, and you'll see more about the models, is what matters less is the exact end date of this phase. Obviously, if people could stay at home forever, the healthcare professionals would be thrilled. If people could just stay at home all of May and June and July, this thing would go away. But people aren't because they can't. 40% or so of Coloradans are living paycheck to paycheck. It's not optional. They have to earn a living. And also, I don't believe it's psychologically sustainable for Coloradans to go for many months without leaving their home. There's just no evidence that it is. So what's more important than that is how we keep up the social distancing in this next phase. How do we make sure that we have 65%, 70%, 60%, in that range, less social interactions than we did in January and we took for granted in January. We have even higher than that now. It could be people are having 80, 85% less interactions. But as we get back to something that people can sustain for the weeks and months that are needed, it needs to be something that protects our health, but is also economically sustainable, meaning the Coloradans living paycheck to paycheck need to be able to buy food, make rent. We bought some time. They got the $1,200, thank goodness, $2,400 for a couple. But unless that's coming again, people need to work. And of course, psychologically and emotionally sustainable for people so they're not, willfully violating and going out and endangering others.
Governor, will the state continue to rely on cell phone tracking data to determine where and how people are complying with orders? If so, for what reason and to what extent?
Yeah, we use commercially available information from Google and others. Who usually looks at that information? Retailers who are deciding where to put a store might look at what the traffic on that corner is. We look at that as a way of knowing how much people are moving around. It doesn't mean, nor do we need to know, who's moving around or who you are. It's all anonymized. But in the aggregate, what it does, it gives us a sense of what level of social distancing we're achieving. You add on to that the masks. You add on to that the additional workplace protections. And we're hopeful that we can be in a scenario where we can sustain this kind of social distancing and at the same time have a functional economy. People can support themselves and people can have a more fulfilling life that they can keep up for the months if needed until there is a treatment or cure. One more from the phone?
You said earlier that how far you need to up its game with regard to other care facilities. What specifically has been insufficient about what they've been doing to this point? And will there be penalties after May 1st if what they're doing is still insufficient?
Did you say senior care facilities? Was that your question?
Yes, sir.
Yeah, so these additional measures are the mask requirements, the screening requirements, the enforcement. They all have to present what we call an isolation plan to the Department of Health by May 1st, meaning what are their plans if there is a patient or two that manifests symptoms or test positive. So those are the additional steps. And like it has the force of law of Colorado, like any law, it's enforced, meaning it's enforced generally through local law enforcement. And we're very serious about enforcing that at the business level, right? It's never been about anybody. I don't think there's anybody who has been, as an individual, charged with violating stay-at-home. There might have been some that were arrested or bothered, but I don't think anybody was charged. If there was, you can let us know at the individual level. But businesses, there's a more serious level of enforcement that needs to occur. The nursing homes are businesses, the congregate care facilities are businesses, and we need to really make sure that working with the local law enforcement, that they are taking every precaution necessary to keep people safe. And this is important both for their residents, for their workers, for the broader potential contamination of society and for our hospital capacity. Because remember, when folks in their 70s and 80s are coming down with it, it might not be the 1 in 10 or 1 in 20 that go to the hospital. It might be 1 in 3 or 1 in 4 that need hospitalization when you get into some of these nursing facilities. Last one from the room.
Governor, can you talk about why you decided to take these additional steps for nursing homes and senior care facilities? It seems like the situation has gotten worse, and this has become one of the worst parts of the infections in the state, and certainly the deaths. Was it those new numbers that prompted you to do this?
So, as I said, when I first talked to Governor Inslee and they had the outbreak in Washington, he said, take these steps first, and I wish we had. We did, and there would be a much worse outbreak and trajectory had we not taken those steps. But that doesn't mean that we shouldn't take additional steps, and we are, both on enforcement, compliance, because again, some nursing homes and senior centers are doing it very well. Others absolutely need to up their game by giving the order the force of law and updating it. We're really making sure that happens. And then the other piece we found, the other kind of hole we found, is not every facility had an isolation plan, and that's why they all need to develop it. The state will help. We have some beds in Westminster, right? So we can help. But for most of those facilities, it means moving symptomatic patients to another area, making sure that there's not a roommate, making sure that their food is dropped off and people aren't entering or exiting other than for medical necessities. So it's all of those steps, along with being more explicit about those checks when people enter, right? So we put out that video. That's very close to what we had already essentially been requiring, but we are now going to be more explicit about what they're all doing, because while many have complied, there has also been others that have been short-circuiting some of those needed temperature checks and questions of people that are coming into the building. So that will continue. We're very serious about protecting the most vulnerable throughout this crisis. In the coming weeks, as the caseload, we hope, stabilizes, and, you know, as Jesse, it may go up, it may go down. We're hoping there's not another peak, as you put it, but I mean, yes, probably up and down and up and down, or up and up in a slow rate, or stable. It is still the greatest risk to people in their 70s and 80s. And it's also the greatest risk to our broader society in terms of the increased hospitalization rate and putting more healthcare workers at risk, because more people who are that age can't recover safely in their home and remain in isolation, but they do need the treatment. They do need to go in. And we want to make sure we have the hospital beds to serve them. Thank you all very much for joining us today. And look, we're all in this together, Colorado. We've been through tough times before. We've been through floods and fires. We've never been through something quite like this in our lifetimes, but we are going to get through this together, and we're going to be even stronger at the end of the day. Thank you.